All right, everybody, we're live now. So, hi, everyone. Tonight, this is Deborah Jones, your Blue Table Talk host. Tonight, we have a real good message coming to you tonight. We're living with lupus tonight. So, we have some people on, some guests on here that will talk about living with lupus. We also have Dr. Williams, who is a great doctor in our community. So, let me do a little housekeeping as usual. You know, look, if you haven't received your vaccine for COVID, please go ahead and get it so that you can mingle with your family during the holidays. And so, and if you don't have your COVID vaccine, please be careful because you don't want to give someone else the disease itself. Because I know a lot of people who've had COVID and they weren't too pleased with it. So even my own daughter, she had it. So she was, she wasn't too pleased with it. But go ahead and get your vaccines. And if you think you have COVID, you can go to Beaumont Urgent Care over on Dollar, excuse me, over on Dollar Street, and you can get be checked for it. Also, and you can get your vaccine there too. But they do the vaccine through the week, and they check you for it on Saturday. And you can also go to MD Kids and Pediatrics. That's on I-10 North Frontage Road, Suite 100, and to be checked to see if you have COVID. Let's go ahead and do what we need. They have that they have the Moderna, the Pfizer, and I can't remember the third one they have out. But I think at Beaumont we only have Moderna and Pfizer. So also Christmas Pump too. You can go over there and get your vaccine. That's on Donald also. Okay, so you know what we're doing in Beaumont, Texas right now. We're getting ready to vote again. We have a runoff election, and it's our mayor election with Robert Donato Mouton and also Roy West. So the polls will be open Monday, June the 7th, and throughout Tuesday, June the 15th. It will be closed on June 13th, which is a Sunday, but it will reopen again on that Monday. Throughout the week, Monday through Saturday, it's open from 7 a.m. to 5 p.m. And the following week, which is Monday, June the 14th, we're open at 7 a.m. to 7 p.m. Election day is June 19th. Does that ring a bell to you? Juneteenth. Okay, so remember, go out and do the early voting because on Juneteenth, what do? You're right. We go ahead and eat that barbecue. We barbecue all day. Do what we do. We do us. That's our Independence Day, and so we have fun that day. But before you having fun, the polls open at 7 o'clock on the election day. So we're not gonna be doing nothing at 7 o'clock in the morning. So maybe 7:30, but not 7 o'clock. But go ahead and vote and get everything together so that we can have a mayor right here in Beaumont, Texas, Jefferson County. Okay, so we're talking about lupus tonight, and we have three guests who's living with lupus, and Dr. Williams is our support system. So we're going to ask them to introduce themselves and give a synopsis about themselves. We'll start with you, Andrea Thelma Johnson.
All right. Good evening, everybody. My name is Andrea Johnson. I'm Deborah's first cousin. And I'm a resident of Houston, Texas. I've been teaching in the HISD school system for almost 40 years, and living with lupus for about 30 of those years. So that's a little bit about me. I'm glad to be a part of this group. It's always good to have support. It's always good to be able to speak with other people who are going through what you're going through. So thanks for inviting me, Deborah.
Thank you. Kim? Kim, and you're muted, Kim. Okay.
Okay, can you hear me?
Yes.
Okay. I'm Kim Levine. I'm an X-ray tech. I've been a tech for 38 years. I was diagnosed with lupus in 89, so I've been living with lupus for 30 years. And I'm just here to share my journey. praying that it will enlighten somebody and hopefully give somebody hope that may be dealing with it or have a family member that's dealing with it.
Right. Garland?
Oh, so hi, I'm Garland Young. So I was, well, first of all, I am a licensed nutritionist. So I have a master's in nutrition and integrative health along with herbal medicine. I've had lupus since 2011. I was diagnosed a couple days before my 21st birthday. So for about the last 10 years.
Wow. Wow. And Dr. Williams was
And I'm Dr. Deborah Williams, and I had a private practice in Beaumont for a number of years, and I've retired from that, and I currently do health education in Beaumont, primarily dealing with diabetes, but also do education with other chronic diseases here.
That's good.
okay. So I hear a feedback, like someone have a phone on or something. You guys mute your phone so that the feedback. The audience, can you tell?
My phone is down.
Huh? If
My
anybody
phone is
to
down.
tell me whether I can
It's
hear,
on the off.
let me know what's up. Okay, so let's talk about lupus. Dr. Wade, what is lupus?
Lupus is a disease of the immune system, and our immune system is supposed to protect us from infection. But when you have lupus, the immune system fights against our own body, it fights against our tissues, and this leads to tissue damage. What's supposed to protect us becomes our major enemy. And when it does this, it causes problems with everything from the hair on our head to our skin to all the major organs in our bodies.
Wow,
Mhm.
wow.
That's a simple way of putting it.
So guys, how did you know that something was wrong?
Well, with
Okay.
go ahead.
So I about my sophomore year in college, it was after I had received a couple of different vaccines, and then 6 months later, I had started to have like flu-like symptoms. Into the summer, I started having joint pain, and I realized now I was having pleurisy, which is like inflammation in the lining of the lung, and acid reflux. And every time I went to the hospital, they were like, well, you just have pleurisy, or no, they were like, you just have acid reflux and maybe arthritis. And nothing was really helping except it was so bad that they were putting me on about 800 milligram ibuprofen 3 times a day just so I could walk around. And at one point, I got a really big bruise on my leg, and my mom got concerned, and she took me to the patient first. And they were like, "Your platelets are at like 10,000, 4,000. They're supposed to be in, I think, 100 thousand." So they took me in an ambulance because they were saying if I bleed in any way that I would bleed out because of the low platelet count. And they finally ran a bunch of tests while I was at the hospital, and they figured out it was lupus, and that was a couple days after my either before or after my 21st birthday.
Anyone else want to interject on it? Kim, Andrea?
Well, when I found out, actually, a couple of years before I was diagnosed, I had one episode where I woke up one morning and I was hurting all over, and so I had to. I went to the emergency room, and they ran all kind of tests and told me that it was probably some type of arthritis. And they told me at some point in time I needed to just go to a rheumatologist and be checked by a rheumatologist. But being young like I was, that pain went away and everything went fine. And I just kind of forgot about it and felt like it was just something that happened. And then 2 years later, I became pregnant. And that's when everything broke out with me. I went in, they knew that I started breaking out in rashes, little rashes over my body. And so my gynecologist, which was Dr. Bost at the time, he felt like something autoimmune was going on with me. So he would have a high risk specialist come in, Dr. Ryder from Houston, And me and my husband at that time met with Dr. Lupus. Now I was pregnant at that time, so it was only so much that they could do. So he just gave us statistics at that time. He gave us the statistics of what can happen to a pregnant woman with lupus, the statistics of what can happen with the baby, and they just give you. He just let us know that gave us the percentages of the mothers that make it and the mothers that don't make it. And so he told us to go home and talk about it and make a decision if whether or not we wanted to go forward with the pregnancy. He said we needed to make the decision because he told us, there's a possibility that you won't make it through this if it is what we think it is. So anyway, and my husband at the time, he told me he wanted me to make the decision. He didn't, because it was my body, and he didn't want, he just felt like that wasn't a decision for him to make. And I prayed about it and I prayed about it. I actually made appointments to they made appointments for me to abort the pregnancy. And I think I had like 3 appointments that I never showed up for. And me working in X-ray, having access to ultrasound, I would always I'd have these appointments and I wouldn't go, and my coworker would do an ultrasound and I could see this little heartbeat. So I just said, I prayed and said, God, it's in your hands.
In your hands, yeah.
And pretty much everything that the doctor said would happen happened, other than me losing my life. The baby didn't make it. I went into toxemia in 5 months. They didn't think I was gonna make it. But God said not so. But I was on strong drugs. It had already affected my kidneys. When that happened, my kidneys were already involved, which is with lupus. They'll say stuff like the last stage of lupus is when it affects your kidneys. And so I was starting out at the last stage. But the drugs I had to take, I had never heard of anybody other than people with cancer taking it. I had to take chemo because they felt like steroids would not help my kidneys. Steroids would not prevent me from losing the function of my kidneys. I needed something stronger. So I did chemo and steroids, and it worked. My kidneys are still functioning. So mine started out really, really aggressive.
Yeah.
So.
Wow. You are really a blessing. With me, it started with skin lesions. I had a lesion, as Kimberly was speaking of, I had a lesion on the end of my nose and right behind one ear, and they just wouldn't go away. They stayed for months and months, and I kept putting it off. And it was a one on my nose, of course, it bothered me the most. So I spoke with my doctor about it. He sent me into a dermatologist, and they did a biopsy, and they first diagnosed it as discoid lupus, which basically involves the skin, the rashes, and things of that sort. But just to be sure, they sent me to a rheumatologist and did the blood testing and things like that. And so I did have lupus erythematosus. At that time, there was a drug. I was working with a rheumatologist here named Dr. Berman. I remember him. And I didn't have, thankfully, I didn't have any of the symptoms that Kim had at the time. But what he did was there was a drug that was just being used experimentally for lupus called Plaquenil. It's a drug that the last man that was president spoke about so highly. I started on that drug. He started me on it. He said, let's just see. It's experimental. He asked me if I was willing to be a part of the experimental trial. I just said yes. And it's he said that what they were thinking that it would do is to slow the progression of lupus as far as affecting the internal organs and things like that. And thank God it did. It has. I'm listening to Kimberly, and I'm just thinking that um, it's, God is really really good. I'm glad that He's brought you through that. I listening to your story, I haven't suffered nearly as much. I do have, after that, the aching is from time to time, the flare ups. Um, but as far as the discovery and things like that, it was caught. I think it was caught just in time by the grace of God, and I was able to get onto Plaquenil, and it has really, really helped. And but listening to Garland, I'm thinking back now when I was in college, I had 2 episodes of fluorescy. Nobody associated with lupus at all. And it was years before. I also had acid reflux a lot. Nobody associated with lupus. But then when I had the skin, the rashes, that's when it all came to fore. So listening to the other ladies, there are commonalities. And I thank God for where, He's brought you, Kimberly. You really have a testimony. You really,
Mm-hmm.
really
Right.
do.
Mm-hmm.
And there's two different types. Like you mentioned, there's this discard lupus, and then
Hmm.
there's systemic
Systemic.
lupus
Systemic
Right.
lupus.
erythematosus.
Yes,
So
yes.
there's two different kinds, and I was
Mm-hmm.
diagnosed with both. I have
Mm-hmm. Yeah.
discord
I have.
lupus, and I have the systemic kind.
Mm-hmm.
Yeah.
And the Plaquenil, the drug that you took,
Hmm.
Plaquenil, I started that in '90 when I
Okay.
started seeing a dermatologist to help me because
Yes.
it had attacked my. Because see, lupus, it any the reason it can attack any part of your body is because every part of your body has a lining,
Mm-hmm.
and
Mm-hmm.
it attacks that
Exactly.
lining.
That's right.
And with
Yes.
when it starts with your skin, you may have scars,
Mm-hmm.
and the different lesions. But when that start affecting your organs, that
Yes.
scarring, just like we get scarred, like if something happens to them, we get scarred, and
Mm-hmm.
that skin gets tight where it's scarred. Well,
Yeah.
that's what it does to the organs. If when
Wow.
it starts affecting the organs, it scars the lining of those organs, and it doesn't allow the organs to
To
function
function.
properly
Yeah, I can
like
see
they
that.
should.
Wow.
Mm-hmm.
So I'm still on Plaquenil. I've been on
Yeah, I am too.
Plaquenil
Me
I
since
too.
have.
'90.
Yes. Yeah. And I've.
It,
Mm-hmm.
I know the last president talked about,
Mm-hmm.
um, it being helping with, it's an anti-malaria drug, is
Yes.
what
That's
Yes,
what it
it
Plaquenil
is.
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 Yes. Yes.
When they
Um.
first came out with it, it was to treat malaria.
Mm-hmm.
Uh, with people with malaria,
Mm-hmm.
and they found that there was a connect with this autoimmune
Yeah.
disease, and
Mm-hmm.
it has definitely been a blessing to me.
Oh
You have
yeah.
to be
It
careful with your
definitely
eyes.
does.
You
Yes. You
have
have
to
to
have
get checkups
your
6 months. Every 6 months. Yeah.
every six
Yeah.
months
Yeah.
because
Yeah.
it can
Mm-hmm.
affect your eyes. And I at one
Mm-hmm.
time had to come off of it, and they tried
Yeah.
some other
Mm-hmm.
older drug.
Mm-hmm.
But thank God, my whatever they were seeing, some of the crystalline, it had disappeared, so I was able
Yeah.
to get back on the Plaquenil again. But Cytoxin was the main thing that helped me, which
Hmm.
was the chemo drug that I didn't
Mm-hmm.
want to
Wow.
take
That's yeah.
because it was devastating, to for them to tell me that in order for us to save your kidneys, this is the drug that I
Yeah.
believe that you need to
It's gonna,
take.
yeah.
And
Mm-hmm.
I knew about chemo because my patients, I'm a mammographer, and I've
Mm-hmm.
had patients with breast cancer that had to take it, but I had never heard of it being used to
Yeah.
treat anything else.
Hmm.
Mm-hmm.
But they do use different chemo drugs to treat autoimmune diseases.
Yeah.
So it all has been a blessing for me.
Yeah.
I have
Mm.
the Cytoxin. I think I've been on Cytoxin maybe over the 30 years, probably about 7 times. And now I'm just taking a regimen of the Plaquenil,
Mhm.
and I take a drug. Also, there's a drug that they use for anti-transplant rejection drugs. It's
Cellstep.
people take this drug to
Mhm.
keep their transplants from rejecting,
Mhm.
Cellstep.
and it's called Cellcept.
Oh,
Yeah.
okay. Mm.
Cellcept.
Yeah.
And that drug has been a blessing to me also.
Yeah.
Yeah.
So I've taken all the way out there drugs, but they've been a
Yeah.
blessing to me.
Wow.
Yeah,
That's
I think
So
I've had a host of medications as well. The first one, when they first diagnosed me, they put me on steroids, so
Yep.
prednisone,
Yep. I've been on
and
prednisone.
Plaquenil. So I've been on prednisone and Plaquenil
Mhm.
the entire time. And it
Mm-hmm.
wasn't fully helping. Like, I was still in college at the time and I just became an RA. I'm in a
Yeah.
sorority
So
and I
yeah.
had an internship as well. So it was a lot, but I just had to, push through it because every morning I would wake up swollen. My
Yeah.
hands would be locked in a certain position.
Mm,
My knees and feet would be swollen, and I would just, get up, walk it off till I went to class, and then have to go through the same thing by the time nighttime, as
yeah.
the medicine wore off. So they started me on, like you said, a lot of different things. I think they tried Imuran,
Yeah.
methotrexate, um,
Mm-hmm.
and
Mhm.
eventually they wanted me to go on Benlysta. I don't know if anybody's heard of that.
Mm,
That's a newer lupus. It's an infusion, so I had to go
Yeah.
in
okay.
and sit
Yeah.
for an hour
Mm-hmm.
while they
Wow.
put it in through an IV. And I only did that for a year. And after that, I'm on CellCept now. And CellCept has really helped my kidneys because I started having too much protein in my urine, which lets them know that
Mhm.
there's problems with your kidney
Mm-hmm.
function.
Mm-hmm.
And CellCept has helped tremendously.
That's good.
Yeah.
That's really good.
Yeah.
Wow.
A lot of the
Okay.
drugs they combine the antimalarials and the steroids because keeping
Mm-hmm.
them it'll help to keep the antimalarials low so they won't give you the problems with the damage to the retina if you combine them with the
Mm-hmm.
steroids,
Yeah.
and
Right.
also to keep the steroid levels low because
Yeah.
steroids have
Because
side
it,
effects that you don't
Right.
yes.
want. Also,
Yes.
that's why they do those in combinations most of the
Mhm.
time.
Yeah. And with the steroids, my doctor has only given them to me in times of maybe high stress,
Yes,
like my mother's funeral, or times when it's going to be really, really stressful,
yes,
Mhm.
yes.
but not constantly. And then I'm also
That's
on
right.
an anti-inflammatory naproxen, but
Yeah.
those are, thank God, those are the only two, the Plaquenil and the naproxen that I take daily.
Oh
And
wow,
just,
you're blessed. Yeah.
yes,
Mhm.
it is
Yeah.
truly a blessing listening
Yes.
to you
Yeah.
ladies. And I really I give God the glory, but I think the
Absolutely.
Plaquenil, I think taking the Plaquenil as soon as I did, has
Mhm.
really helped tremendously.
Yeah.
Yeah.
Right.
Yeah,
You
and
know,
Mhm.
there are different degrees of the lupus. People will have
Yes.
like
yeah, that's what she's saying. Right.
Hmm.
Kim had a more
A
severe
really
case,
severe case.
Right.
and some
Yes.
people have mild degrees of it,
Hmm.
Mhm.
and
Yeah.
moderate degrees of it. Like
Hmm.
a lot of diseases are.
Yeah. Yeah.
Mhm.
Hmm.
Mine more so progressed over time.
Hmm.
Um, Eventually, it turned into fibromyalgia.
Oh
So
yeah.
a lot of like nerve pain in my
Mhm.
arms, and in my back and in my teeth. And then recently it's progressed to Sjogren's, which is
I've
another autoimmune
yes.
condition.
Yes.
And it
Yeah.
causes you to have dry mouth, dry eye,
Hmm.
dry skin. And that was another thing. I didn't realize what the issue was. I had been
Hmm.
having back and forth, like maybe for a couple weeks over a course of the year. My eyes would get really dry, my mouth would get
Yeah.
really dry, and the eye doctor just gave me some eye drops. And eventually, one day, my throat and tongue started burning every time I ate. And I was like, well, this something's obviously wrong. And so I
Hmm.
started looking on my lupus groups and on Facebook and asking some of the people on there and, doing a little research. And I realized I had Sjogren's. And, that's when I called my doctor and had an appointment with her. And she's like, well, yeah, you probably do because you've had the antibodies for it. And it also started affecting my kidneys. That's why I'm on CellCept, like I said, as well.
Yeah.
So it's just kind of progressed
Yeah.
over time.
And I have had well, actually, my primary care said that I probably have Sjogren's as well because my skin, as you said, it's extremely dry mouth, and I also develop mouth ulcers, um,
Mhm.
and very, very dry eyes. But yeah, but not my rheumatologist, but my primary care did say that as well. Yeah, so they're overlapping, overlapping.
Yeah,
Hmm.
they are.
Yeah,
Yes.
yeah.
And
Yes.
what has helped me with the Sjogren's is actually sea buckthorn oil. So it's an
Oh,
herb. And because it was really bad. Like I was miserable all the time. And that actually, I want to say helped with 70% of it. So
wow.
it's, it's a natural herb. So you'd have to talk to your doctor about any,
Okay.
mixtures with the medicine and make sure there's no effects. But that has helped the Sjogren's tremendously.
All right. Thanks for
Hmm.
that information. Yeah.
So how has your life changed since you've had lupus?
Hmm.
Lord, I've had it so long.
Yeah.
Yeah, I guess
Change.
at
You
this
just,
point, I don't, I guess I don't know. I don't remember what it
yeah.
feels like to not
Yeah.
constantly,
Yeah.
be in pain and have an issue. I pretty much tried to like keep pushing anyway since I was in college. So I did pretty much what everybody else was doing. I tried to make sure that I ate a certain way because I know the different things you eat can affect your lupus and cause flares. And that's actually why I became a nutritionist, more of a holistic nutritionist, because I realized while I was at school, I was like, okay, if I eat sugar, my face swells up
Hmm.
and it hurts. If I eat something with a lot of sodium in it, my face swells up. And so when I would tell my doctor, they were just kind of like, oh, well,
Yeah.
whatever.
Hmm.
And that's when I started looking into, because my mom's always been into like holistic and eating well and nutrition. So that's why I went to a more holistic and integrative health school to get my master's in nutrition. So it kind of like shift gears on where I was going. Originally I was majoring in political science and mass communication, and I wanted to be a lawyer. I was studying for the exam and everything, and I feel like God just pushed me in a different direction because I wanted to be able to help, other people with different issues. Like my dad has rheumatoid arthritis, and he was getting really bad. He was in much as much pain, as I was, and I could tell him everything that was going to happen based on what was happening to me. And but he was eating foods that are inflammatory towards lupus, like nightshades, so potatoes, tomatoes, eggplants, any peppers. They're inflammatory in people who have autoimmune conditions. And so I took him off of that. I took, and he's a guy, so his favorite thing is to put a potato in the microwave and make spaghetti. And so I told him, to cut those things out, and he was eventually able to go off of the medication for the rheumatoid arthritis, and like he's fine.
Hmm.
So,
Mm.
Dr. Green, I'm listening to Garland and the rest of them talk about it. And Garland was saying that her dad had this autoimmune disease also. So, is it hereditary?
It has not been shown to be hereditary, but about 5 to 10% of people with lupus have a close relative with the disease.
Hmm.
That has
Yeah,
been
I have a
shown.
sister with lupus.
Uh huh.
I have an
Oh,
uncle with
wow.
lupus.
Yeah, but
Because
they have
I
not.
was,
She was diagnosed after many years after she was
Uh
just
huh.
recently diagnosed
Mm.
with well, I say recently, maybe 3 or 4 years ago. She was
Yeah.
diagnosed with
Yeah.
lupus.
And
So
because I don't think anyone in our family but
no.
my sister has it. But
Yeah. And
I have a sister, Ruth. You know my sister Ruth. I
Yes.
have a
mhm.
sister Ruth. She has autoimmune disease, and I asked
mhm.
her today what was it, and she told me, but by me not, I think I heard Garland say it, but by me not knowing,
Sjogren's.
Sjogren's,
huh? No,
Sjogren's.
I
Shogun.
think it starts with
Sjogren's,
a
Shogun.
P
Mhm.
because of
with a P.
bones.
Polymyositis.
There it. That's
Hmm.
All right.
that's
Hmm.
And there's another thing about estrogen, because women are 9 times more likely to develop lupus
Hmm.
than men. That's how.
Mhm.
That's why
And
hormones appear to play a factor, because they think that estrogen is
yes,
immuno enhancing, meaning
as
that
Mhm.
it
yeah.
has a tendency to make maybe women more likely to develop an
Mm.
autoimmune disease. So it's something about estrogens that
That's
make women
right.
more
And I was,
able
yeah.
capable of having an autoimmune disease.
Mhm.
right.
And
Isn't it
I can
black
see
women
that.
too?
Yeah.
That's right. And that's what they said with me with the pregnancy.
Hmm.
Mm-hmm.
And I was
Uh
diagnosed right after I delivered.
yeah.
I had just right after the pregnancy. Yeah.
Yeah.
Mhm. That's
So
right.
it
What
was
you getting ready to say is that women, if they cannot have children if they have lupus. Is that what
No,
y'all
they
saying?
can.
no,
Oh yeah, they
Yeah,
have
they
ladies
still
who have.
can. Yeah. Oh yeah.
Hmm.
Yeah, it's actually interesting because my gynecologist told me to have kids because some people's symptoms go away while they're pregnant or, get better. So I've seen some people that I follow on Facebook, and have kids. So people still are, having
Hmm.
children and
Yeah.
having a
Oh,
Oh
healthy
yeah.
absolutely.
pregnancy.
Yeah.
Mm-hmm.
Hmm.
Absolutely. Every individual is different,
It's
you
different.
know.
That's the thing
Yes.
about it. Yeah.
And
Mm-hmm.
I wanted to interject this when you were Garland saying some of the things that you do because sometimes I still deal with a little pain,
Hmm.
but I can always feel mine coming on.
Hmm.
And I had a patient one time that she had no idea what I was dealing with, but she came in and she told me, she said, uh, we were doing some workup on her for rheumatoid arthritis. And she said, there's this miracle uh, gel that I use. And she said, I kid you not, this is what has helped me to survive. And I'm listening to her, right? And I know what I go through every now and then because sometimes my hands are really painful. So I asked if she would mind sharing it with me, and it's called Arnicare. It's a natural
Yeah,
leaf.
yeah,
My rheumatologist told me
yeah,
about that.
Let me
yes,
tell you something. What I do when I feel that pain coming on, I can, you can always feel the soreness.
Hmm.
I have the gel, I have the roll on, and
And
right,
I will rub my hands.
Uh-huh.
right,
And y'all, I wake up the next morning and my hands are in no pain.
right.
So I try to catch it when I feel it coming on, and this stuff has really helped me as
mhm.
far as pain is concerned. And it's called Arnicare,
On the
and
care.
it comes
Art
from
is really good.
arnica is a natural it's a natural leaf, and that's what they use to make it, and it has helped me.
Now,
So
Spell
now
it.
my doctor was he really the nurse practitioner. I
Hmm.
was in pain, and I have arthritis,
Hmm.
so I was in pain, and so she told me to go and get some Oni care,
Hmm.
and so I'm like, what is that for? And so she said, just rub it on you, and
mhm,
you're gonna feel okay. So
Really
I did,
yes,
and there was no more pain. That is
Spell
that.
it.
Lupus
Spell it, lady. Spell it,
it's
lady.
ARNI
CARE.
CARE, but
Okay.
it comes from arnica.
Okay.
ARNICA is the natural ingredient, is the natural thing. Look, now I need my glasses, y'all. I
and
told
there,
you I
yeah,
need my glasses.
and there are
What?
other brands also. Arnicare, I think,
Oh,
is
are
the
they?
brand name. Yeah, and they have CVS has has their
Oh,
own,
yeah,
Oh yeah, they do.
Arnica, and Walgreens. So, but it does work really
The
well.
right.
first thing that I got was from HEB, is where I got the gel. I got the actual gel from, but CVS does have some. But
Okay.
it comes from Arnica,
Arnica,
and they
yeah.
call it Arnicare.
Mhm,
Okay.
So
mhm.
All right. See, I
So
learned something tonight.
what are some of y'all biggest challenge of living with the chronic illness?
fatigue is my biggest
Yes,
challenge.
yes.
Fatigue
That
is
would be
just
mine as
fatigue.
well.
I
And
just your mind, you sit and you think about things you want to do, but your body says, hold up,
yeah,
wait a minute.
exactly.
It's not gonna happen, and that's one of the hardest things I think with what that I have to live with is just dealing with the fatigue, because sometimes I wake up in the morning and I'm 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 feeling
Mhm.
tired, and it's just, my mom said, and the doctors felt like, they said something like, you probably had this since you were a little girl. And when they started talking about fatigue and not being doing anything, my mom interjects, well, I just thought she was lazy, but it affects you that way.
Right.
You don't have
Yeah,
the energy that uh normal people
yeah,
have.
yeah.
Right.
And so you have to pace yourself.
Hmm.
When you got an event coming, you have to, you gotta bring it down so that you can,
Have energy
uh,
yeah,
you do.
yeah.
Yes.
Especially when you're working full time. If you're working a
Yes.
full time job, then
Yes.
other things kind of fall by the wayside because you just don't have the
Can't
energy.
do
And
it
the
all.
thing with me is just, missing out on a lot of things, maybe family things that happen because by the end of the week, it's just gone.
Mhm.
And yeah, so that would be the main
Hmm.
thing for me.
Yeah.
That,
You
that's
know,
what it is. Can another illness cause the lupus symptoms?
Lupus is called the great masquerader because that's why a lot of people will go 4 to 5 years before they get a diagnosis because it is a great masquerader. Just look at the symptoms they've had. There's a lot of other things that can
Yeah.
cause that. And so they've gone. A lot of patients have gone from doctor to doctor before they get a
Trying to figure
diagnosis.
it out.
They really have.
Yeah,
But
Yeah,
yeah.
it's very
what
frustrating.
kind of doctor should they see?
Rheumatologist,
Rheumatologist, yeah.
a rheumatologist.
Hmm.
Yeah, yeah,
Once you
Yeah, I would say
finally
I'm
get the
pretty
diagnosis, yeah.
blessed to have found out from the patient first, and they were the ones who had tested my platelets and realized that. So I was blessed to go there and go to the hospital here and them actually figure it out, because I know people,
Hmm.
like you said, go years and
Yeah.
years
that's
and
right,
years
right.
without finding out what's wrong with them. And I was gonna say,
Hmm.
like, the probably the biggest hurdle for me besides the fatigue is the lung issues that I've been
Yes,
having, which I started getting fluid in my lungs, which sometimes happen, and
yes,
it was uncomfortable laying on one side or the other. And so I went to the doctor, and they sent me to a pulmonologist, and he
yeah,
wanted to drain the fluid, which I was not a good idea because at the end of the day, it was just going to come back. But
Yeah.
for some reason, my body had a really bad reaction to it. So I only had fluid in one lung. After he drained it, the fluid came back in that lung the next day. In the lung it was originally not in, and my lungs became inflamed, and I spent a week in the hospital. And after that, like, I couldn't lay down for 6 months because it hurts for me to like lay down, and that's been going on for the past 5 or 6 years. Like, it's just
yeah,
constant. It's hard to get around, it's hard to breathe. Sometimes just walking from like my room to the bathroom is like
yeah,
completely knocks the wind out of me.
yeah,
And I can't really take deep breath. So I have no idea to explain. Like, I don't know if that's ever happened, to anybody, but that's probably the biggest hurdle because I think the cell step has pretty much helped with a lot of the joint pain and the hand inflammation and the knee pain that I had. So now it's just the constant issue, with my lungs that's made the major problem now.
Yeah.
But
yeah,
does it affect your career? Any one of you guys?
Well, I'm been able to. I doing what I do. I'm pretty much on my feet all day, and it's it can be a really challenging thing. But like, there's been so many days that I have gotten up to go to work and felt bad, and sometimes in pain, but I still would press on and go to work. And I find that as the day go by the end of my day, I'm feeling so much better than I feel like I would have if I would have stayed home and just, you know, and just let it take over. So
Yeah.
I just press on. But yeah, it gets hard sometime at work, but I just thank God that I have coworkers that know what I'm dealing with, and they're very, caring. So I just feel like I'm blessed, doing what I do, and then having the people that I have around me, because
Yeah,
it
that
makes a
helps.
difference. You
Yeah,
know,
it
it
really
makes a
does.
difference.
Yeah, yeah,
So
it really, really does. And you know, teaching is challenging anyway. I teach middle school start. I started middle school, and I teach high school math. And what I've had to do is to get out of the traditional classroom, and I now work with a smaller group of students, and that's helped the stress level a lot. Because there were days when I just did 35 to 40 kids. It just, it was just a lot.
stressful.
Just a lot. It was very
Mhm.
stressful. So I was really blessed to be able to find a different type of. I'm still with HISD, but I'm working with students that are maybe more challenging, but it's a much smaller group of kids, and so it's been a blessing for me as well. Yeah.
Mhm.
So, yeah. You just kind of adjust and
You
just
have
learn to
to.
live with it. Yeah.
Mhm.
Yeah. Yeah.
Yeah, I
Yeah.
agree. You just kind of learn to. Oh, go ahead. you
Right,
just
quick.
kind of learn to, go with the flow. I agree with you on this. Sometimes when you feel bad and you just push through and get up in the morning,
Mhm.
that throughout the day you
Yeah.
do start to feel better. I feel like your joints kind of warm up and things get moving. And then also I feel like it distracts you from the pain. Like
Yeah.
you're doing something, and
Yeah.
so it
Mhm.
distracts you. If you just sit down, all you're thinking about is that, the fact that you hurt.
Yeah.
Mhm.
Yeah. Yeah.
Yeah,
Wow.
Exactly. Yeah.
absolutely.
Sometimes I don't know. I think I've seen Andrea. Like I say, Andrea's
Hmm.
my first cousin. So when we used to go to Houston, I think at one time
Hmm.
I saw you on your knees.
Hmm.
Like you was hurting so bad, and
Hmm.
so
Yeah.
I
Yeah.
didn't know
Yeah.
what
Yeah.
was going on.
It was. Yeah.
Yeah. So
It's.
she said, "I'm in pain. I'm in pain," and
Yeah.
I think that your mom was she living at the time? Was she
You know what?
somebody
Yes,
had
she
lupus,
was.
and so I'm
Yeah.
like, I didn't know what
But
lupus
my
was.
yeah, yeah, and before I was
Yeah,
diagnosed, I didn't either. And then that's when I learned that our cousin, that I was telling you about, that she had it. But that's our cousin on our, well, my mother and your father's side, their birth mother,
mm-hmm.
one of her cousins, and so that's why I was wondering about, the whether it was hereditary, yeah, or
Yeah,
not,
it's
yeah,
like second
because
generation, and yeah.
maybe so. That's yeah, I did, yeah, I wasn't very sure about that.
Hmm.
Mhm.
Um, but now since you say that Ruth also has an autoimmune
Right.
condition, yeah.
So
So
does that collaborate with one another? Are they the same or what?
No, they're different diseases.
Okay.
Yeah, lupus and polymyositis, the
mhm,
Sjogren's, they are different diseases. They're all autoimmune diseases, but they're
Right,
different
same
mhm,
diseases.
family.
All
yeah,
right,
yeah,
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 same family. Yeah,
same family,
yeah.
yeah,
Mhm.
yeah,
But
hmm,
they cousins, and some cousins
right,
are
yeah,
worse
right.
than others.
But they will not. The scientists will not say that they are genetically linked. They will not
Right.
say that they
yeah,
are genetically linked.
Right.
They still
hmm,
say they do not know the cause of lupus. However,
exactly,
there are some medications that can cause the lupus-like syndrome. Some blood pressure medications, like the old
Really?
medications they've been used, like
mm,
hydralazine and
Mhm.
wow,
other kind of things. But once you stop taking those medications, in a few weeks to a few months,
It'll
it'll
subside.
reverse.
oh,
It'll
Mhm.
oh.
reverse. Yeah. And being out in the sun can aggravate. Well,
Hmm.
you all know
Right.
being out in the
Always
sun
have
can
to have
aggravate it.
sunscreen.
And they say
Yes.
sometimes if you have that tendency to have the lupus, that
Hmm.
that that could trigger it to get started.
Hmm.
Mhm.
Ultraviolet
Hmm.
light, mercury. There's the
Hmm.
Epstein-Barr virus, the one that causes mononucleosis that they think will set off lupus. Things, environmental
Yeah.
things like that. They
That
really
makes a
don't
lot of
know.
sense
They
because
don't
I
know.
was I'm sorry not to, but I was a lifeguard for years and years.
Yeah.
So
Wow.
yeah, from starting at the
Lot
age
of
of
time.
15.
She never
Okay.
scared
Mhm.
me though.
Yeah, so who knows?
Mhm.
That's lots of time in the
Yeah.
sun. Yeah.
Yep.
So
Yep. We
hmm,
don't know.
this
Yeah.
is all good information. Yeah.
Yeah.
Things I
Mhm.
never heard
Right.
before. Yeah.
So does it change your way of thinking about yourself? I mean, think back when you were younger, and
Mhm.
now you older.
Mhm.
Garland said she was 21 years old when she found out she had herpes,
Yeah. Mhm.
and the rest of you guys, it was like 30 years ago.
30.
I don't know
Mhm.
your age now, so 30 years ago.
Mhm.
So how does it change your thinking about yourself?
Well, for one thing, you don't deal. I found with me is things that I was concerned about, petty things. You let that go in a hurry
Yeah.
because you got more important things. You know what I'm saying? You don't deal with the like the drama. You
Mm.
just let you can't deal with drama and deal with lupus too. You got to let one.
Mhm.
You got to
Yeah.
get rid of one, and
Yeah.
you have control over one you don't have control over.
Definitely.
So the things you have control over, you
That's
got to let
right.
that go.
Yeah.
You
Yeah.
know, so you try to stay as drama free as possible
Mhm.
because dealing with different, it all affects the stress level. So
Right.
that's what you try to
Mhm.
you try to build your life as stress free as possible.
Yeah.
And it's just some
Yeah.
things you can't
It,
deal
it,
with.
it will trigger.
Yeah. Hmm.
Hmm?
It would trigger
Yeah,
it, right?
yeah, stress
Oh
can
yes,
trigger
Stress, definitely
absolutely,
flare up.
stress. Yes,
absolutely.
definitely.
Wow.
So you try to, as she was saying, try to live as free as possible. And I know that with me, it has really increased my spiritual life. It
Oh,
has had to
absolutely.
grow.
Yeah, I know that's
Yeah,
right.
yeah. You just I
I
couldn't do
mean,
it if I didn't. Yeah,
you
yeah.
know it, and and me for certain. I know without a doubt that you know there's a purpose for me being here
Yes, yeah.
because statistically, I should have been gone a long time ago. So I
Yeah.
know
Yeah.
God has a
You
purpose for my
really
life,
have a testimony.
and I
Yes.
can also say, I oftentimes ask myself and have asked myself over the years, would I have the relationship that I have
Mhm,
with God, with
mhm,
Jesus? Would I have that relationship had I not had the journey that I have? And I
mhm.
can honestly
Yeah,
say I probably wouldn't.
yeah.
So
I
for
can
that,
too.
I'm grateful.
Yes.
If it
Keep it
takes
tough.
me being down on my back and going through this journey
Mhm,
to bring me closer to
mhm.
Him,
Yeah.
it's worth it.
Yeah.
Yeah, I think it makes
You
you
Amen.
don't want to have to
appreciate
go
things.
through that, but it's
Mhm.
you know.
Yeah. Yeah. Yeah.
So
Yeah, it definitely makes you appreciate smaller things, more and like appreciate the people that are around you. Cause so many people, when I'm on my Facebook group, they don't have support and it's hard, because
Yeah.
it's kind of like the invisible disease. So
it is.
people, I walk around smiling all the time. So most
Mhm.
people don't realize that I'm
Mhm.
sick. And,
Yeah.
for some people, it's just the constant, well, well, why can't you just do this? Or you're just being, lazy, and that's what a lot of people go through. They go through going
Yeah.
to the hospital and the doctors and thinking that they're just
Mhm.
lying, trying to get
Just
pain medicine and
just
Yeah.
lazy,
all of
like
this
my
stuff.
mom
Yes,
said.
sometimes.
Exactly.
Yeah,
Exactly. Yeah.
it's
Yeah. And I'm like,
it's a
yeah.
lot. So it made me like
Exactly.
I've never, and I probably end up in the hospital like every year, at least a couple of weeks out of,
Mhm.
on multiple occasions. And since I was diagnosed, I've never once stayed by myself in the hospital. Like my mom
That's good. Yeah.
camps out
Has
and
always been
and
Yeah.
there.
she's like my biggest helper
Yeah.
and and supporter,
Keep,
and she's always
keep it
there, like
strong.
so is my
Keep it
dad, and like you say
tough.
Aunt Joan. Like I have
Mhm.
Keep
a
it tough.
really good family base, and I
Support
also have
system.
really
That's
good
good.
Keep it
friends.
tough.
So that's what I found
Right,
out.
right.
Mhm.
One thing is
Well,
especially Kim and Garland, you're young,
and they
and
always
and this disease affects people from 15 to 40 to 44 is when it presents itself.
is it,
You
did
Mhm.
you
know,
hear background?
I didn't hear you.
Did you? Oh, I was saying I could hear audio. I'm sorry. Um, what was I saying? Oh yeah, just having a really good friend base, and they
Mhm.
always look out for me. And so I've still been able to do a lot of the stuff that I enjoy. We go to
Mhm.
Miami and
Mhm.
Las Vegas for like our bachelorette trips and everything.
Oh,
So having their support, and they're always looking at me and checking on me, it's like
mhm.
a blessing.
It is.
Mhm.
It makes
Yeah.
a big difference. Yeah,
Yeah.
because my mom has been there for me through
Yeah.
from through it all. I mean, other family members
Mhm.
have, but my mama's been there
Mhm.
through every episode, every valley, every mountain. And it really it makes a difference.
Mhm.
What about self pity? Do you have self pity for yourself? Or what?
You don't have time to be
Yeah, I
picky.
was gonna say you can't give in to
You
that.
can't
You
do
just
that.
yeah, because it just makes
Mm-mm.
it worse. Then
No.
you're sick and having a pity party. So yeah, you can't.
I
Yeah,
think I've had my moments. I think I
yeah.
had a moment
I was gonna
when
say
when I found out I had Sjogren's.
yeah.
Because honestly enough, like even when I was diagnosed, like my mom took it worse than I did.
Mhm.
Um, and so for some reason, this finding out, adding the Sjogren's onto it, that like I kind of had a moment. But like you said, you don't have time to, I have things to do,
Mhm.
so you can't
Mhm.
sit but
Yeah, I think
wallow.
we all have a moment, but
Mhm.
you
Yeah.
can't, you can't stay in that
But
moment.
yeah,
Right.
You
You got
got
to
to move
step up
forward.
and
have
down.
that moment and yeah, and just try to pick
Hmm
yourself up and keep on going. Yeah.
Because you have to always remember, we see, we're looking in the mirror, but there are people, and with what I do, I see all kind of people going through all kind of things.
Yes.
So, you always feel like, or you may feel like, I'm going through this, but when you are blessed to work in an environment where you're helping people, you get to see so many other people going through worse things than you are.
Exactly.
Then you kind of just,
And yeah.
you got to back off of that
Yes.
and be
Yeah,
grateful.
Yeah. And you just say,
Mhm.
thank God it's not, it could be
It,
much worse.
it
It
could
could
be
be
much worse.
much worse.
Because
Yeah.
it's
Mhm.
definitely a blessing to even have like health insurance, because I see
Exactly.
some
Oh
people,
my
Yes.
they,
gosh.
they don't. And so
Yes.
not being have access to Plaquenil, not
Yes.
having access to
Yes.
Absolutely.
prednisone,
And
having
that medicine is expensive.
It's
Oh yeah,
expensive.
it is. It
Yes.
the
is. It
experimental
is.
one, the Benlysta that I was talking about that I was on for a year, that was about $8,000 a month. And
Mhm.
Hmm.
then even the doctor charged $800 for me to sit there for an
Yeah.
hour for them to put it in.
Right. Well,
Yeah.
Garland, when I first started taking Cellcept, the drug that we're both taking, it was experimental, and I actually couldn't afford it. And at that time, at my job, they started the insurance started the health flex
The
thing,
pay,
where
yeah.
you can
Health
put
fund.
money in, and
Mhm.
Mhm.
yes.
Mhm.
And so what I did, I had to get a major credit card just
Mhm.
for
Mhm.
this drug.
Wow.
And I was able to use the money that I saved, because you see with that health plan,
Yeah.
you put how much you want to take out over the year. But
Mhm.
if you needed it, you didn't have to take the whole year. If you needed it at that one time, you can use
Use the
whatever.
whole thing. Yeah.
And so that was a blessing for me, because the drug was so expensive.
Mhm.
But God has always opened
Yeah.
doors
Oh
for me to
yes.
get whatever I needed. And like you
Mhm.
said, there's so many people that don't have insurance, and that is just so
Yeah.
heartbreaking to
Right.
It is.
know that there are people that are
Yeah.
suffering, that can't
And they
get the
can't
help
get the
because they
help.
can't afford it.
Exactly.
You
Yeah.
know?
Dr. Williams, should people with lupus, experiencing lupus, should they have a bone density test?
Yeah, if you're on steroids.
Yeah,
Oh,
that's right. Yeah,
Mhm.
no, she's right. With steroids, you need to have that
Mhm.
checked because steroids do affect your bones.
hmm
And for a certain age group, you need to have bone
You
density
have to
test
have it
anyway.
anyway.
That's
Yeah.
Right.
right.
Yeah.
Because I'm always having one. So I'm like, what do I have
Mhm.
lupus? I'm
Especially
like,
high dose steroids.
right,
High
Yeah.
dose
absolutely. I
steroids
have to have
because
them annually.
that's
Yeah.
right.
Hmm.
And
right,
yeah.
right.
Mhm.
Wow, wow.
And
So
Deborah, oh, I'm
Uh huh.
sorry.
go ahead,
Another
love.
thing, while we were talking about insurance, another thing that we don't think about is life insurance.
Yeah.
Mm,
Because once you're diagnosed with something like lupus,
Oh
Mm.
yeah.
they categorize you as you have a knockout disease. That's what I've been told several times with different for life insurance. And that they call it a knockout disease
yeah,
because it knocks you out of being able to get life insurance. No one right now, and especially with like myself having kidney involvement, you know what I mean?
right.
It's just then they're not gonna then they
Mm-mm.
won't sign you up for life insurance.
So you never found anyone that will cover you for life insurance?
No, the life insurance that I have through my job,
Yeah.
which
Mm.
was something that I was able to carry, from being on my job, but
Mhm.
it could affect you uh getting life insurance also. And people don't really realize that.
Yeah.
But now, Kim, nowadays, when you get life insurance, they don't ask you all the medical questions.
Well, but
Mhm.
there's most life insurance, you have to fill out a health thing,
Hmm.
and they'll ask you, one of the big things on there is if you've had problems with your kidneys.
Mhm.
You know what, Kim? I've seen some policies that have been advertised, and they said there are no medical questions,
Right,
and there are no medical questions, and no something else. Now, there's some
They-
that they're not doing that right now.
right,
Okay, well that's
I-
that's
right.
that's good
on
to know.
television.
yeah.
I'm gonna try to look for it and write it down, and
Okay,
send it to you.
let me know. Let me know.
I saw that just the other day. There's no form to fill out, no medical questions. I hope they're legitimate. That's another thing.
See, that's the
Same
thing.
with
You
Right.
never
DVD.
know. Yeah.
Yeah.
But
Mhm.
where before I had this program, Kim was the one that came to me to ask me about having a segment on lupus, and I agreed to it and everything. And she also mentioned to me that this was Lupus Awareness Month. So, what do you guys do for that Lupus Awareness Month? What do you guys do to support it?
Just donate,
Mm,
you know,
mm,
because one of the biggest things, like, I find that, I mean, and donations are always important,
That's important, very important.
like, sometimes it takes a movie star, or
Yeah,
somebody,
somebody
you know
with
what I
some
mean,
fame, yeah.
relate on.
some fame to
Mm,
get it to bring real attention, and kind
yeah.
of get more the ball rolling. But basically, there used to be a lupus support group in this area, in mid county,
Mm,
and I was very active at the beginning of my diagnosis, because that's how I really learned a lot. And the doctor that I was under in Houston, Dr. Sandra Sessoms, she was on a panel for the foundation. But also, with the support group, I had to back off too. It's almost like I had to go in and get what I can, and then I had to back away, because, like I said, most of the information and most of the things that you hear is that when you get to the last stage, or you do this before you get to the last stage, and that last stage that they considered the last stage was kidney involvement. So I had to step back
yeah.
from some of,
And not
That's
from
right.
that,
yeah.
from
Yeah,
Yeah.
from
it gets a
hearing
little
that,
bit depressing
That's
Yes.
right, for
yeah,
your
sometimes
hearing
mental,
that
if
all the
you
for your
time.
But
mental
you
health.
gotta,
That's
yeah,
right, for your
exactly.
mental health.
Yeah,
That's
yeah,
right.
yeah.
Because yeah.
It
Uh-huh.
helps if you try to stay as positive as
That's
possible.
right.
Hmm.
Yeah,
That's
you
right.
can't. Yeah.
Yeah.
Okay, let me go to my viewers because they asked some questions. So and statements and giving statements. So Roscoe Compton says, so right now we are really treating the symptoms rather than the illness.
Yeah. You're
pretty
treating the
yeah.
illness. You're treating the illness too. Uh because lupus is two things. You're treating the inflammation and you're treating the autoimmune response of the anti-malarials, the steroids. You're treating the illness. You try to slow down the autoimmune
Yeah.
attack on the body. So you are treating the illness also, because if you didn't stop that autoimmune attack on the body, these ladies wouldn't have a chance. So you are treating the illness also, because that's what's happening. It's attack on the body, and you're stopping that attack. So you are treating the illness, and you're also treating the symptoms.
Linda Spikes Jones says questions are not asked if the policy is under $10,000. Any larger policy will require
Okay.
physical.
That's good to
Right.
know.
And the ones that I were applying for were
We're
more than
over.
10,000.
Well,
Hmm.
Okay.
she also mentioned that you can start help group yourself.
Hmm.
That's true. What I always like try to do is like allow people to reach out to me that have, because a lot of people will come and like my niece, my has been
Mhm.
diagnosed, and so I try to like support other people, especially when they're first diagnosed. So I guess
Hmm.
that's kind of my way of like helping others besides the nutrition, and like helping people with their diet and stuff to be able, because you can have a lot of the symptoms subside with how you eat with your diet.
Mhm.
Like I
Mhm.
said, sugar, especially processed sugar, is extremely
Mhm.
inflammatory, and your body will definitely react to it. And you realize, like, I realize every time I eat is when I start getting sick. And it depends on
Mhm.
what you eat. So diet plays a really important role in how the lupus, behaves, how it's progressed, whether you have flares or not. And I don't think a lot of people realize that, you could be
Yeah.
eating something that is really causing, a autoimmune response in your body and not even realize it.
Right. That's
Right,
true.
that's true. So how do you know when that illness, that your symptom is a mild symptom or a serious symptom? Whereas, and how serious can it get? Put it like that.
How serious can your symptom get?
Hmm.
Well, if it's not caught in time, it can be life threatening.
Yeah.
You know.
Mhm.
Um,
Or are you
That
speaking on a day-to-day basis, like a flare, or?
like a flare up.
Oh, you start to get little signs and symptoms. Like that's how I realized that sugar was causing it because my lip would literally swell up like huge. And so like you start to feel a little tingling and your lip, or if my joints are about to act up, you start to see your fingers, become a little inflamed and become puffy, or your joints start, to hurt. So you can kind of tell that you're going into a flare.
Yeah.
mhm.
Right, right. Well, that sounds almost like diabetes. You know,
Well, no, no.
no.
What
You
do
really won't
you?
get lip swelling and stuff like that with diabetes. Not lip flares. I mean, not lip swelling and like that. Diabetes, uh, with diabetes, when you get problems with diabetes, for instance, if you have a low blood sugar, you get shaky, you get sweating, you may get nervous, you may get confused with the low blood sugars. High blood sugars, uh, you may get the confusion again. You may get weakness. You may get fatigue. If it's very, very high, of course, you can lose consciousness.
Right.
Okay, like that. Okay, again with this is a great masquerade again. She described a little earlier how when she was getting short of breath, when the
Mm-hmm.
lung was filling with fluid.
Mhm.
Okay, that's a crisis situation there
Yeah,
because with lung filling with fluid.
yeah,
Uh, if your kidneys are not functioning well,
yeah.
you're gonna start swelling. Okay,
Mhm.
you're gonna build up fluid again. When the kidneys are not functioning well, you're gonna have swelling again because the kidneys are not uh, uh, getting rid of the
Putting
fluid
out the
like they
urine.
should.
Mhm.
Okay,
Mhm.
so lupus again has a lot of body systems that is attacking. So
Yeah,
you're gonna have an array of symptoms that can come up again, and when you get to the point where they're life threatening, uh, you're gonna end up in the
that's
hospital,
right.
emergency room
I'd
again.
say watch out for the bruising too.
Yes, because she talked
Yeah,
about how her platelets were low. It also could have low white blood cells, also
Yeah.
low red blood cells. You can be very severely anemic. The white blood cells very low. They put you at risk of infection also. So this disease affects. I told you from the hair on your head to the soles
mhm.
of your feet.
That's right.
This
And
disease will affect.
yeah, mentioning the bruising just recently, I have bruises, and just in the last year or so, that just will appear just out of nowhere. And my husband has said take pictures of them, but of course, by the time I get back to the doctor, they're gone.
You're gone.
But
Right.
Mhm.
yeah, but I'm just now putting those two things together. That's something that I never really even thought about.
Yeah,
And that and that bruise can come
naproxen.
from the low platelets. Low
Yeah.
platelets will give you bruising.
Mm,
And
And
naproxen is actually something that causes me to bruise. Like
bruise.
I don't know if
mm,
I don't know if it thins my blood, but I sometimes I get
Mm,
nosebleeds because naproxen, like NSAIDs, anything anti-inflammatory
That's
medicine, it definitely helps. Like
mhm,
it
it
definitely helps
does.
with my lung pain and everything. But for me, I can't
Side
take it
effects.
because of the side effects and
Yeah.
that it causes the GI issues in a lot of
mhm.
people
Yeah.
and
because it
kidney
can
And
bother the
kidneys.
and
lining.
kidney.
Yeah,
Mm,
and
And
Right.
kidneys
kidneys.
as
Yeah, I
well.
can't
Right.
So
take it because of
yeah.
the
That's
kidney
right.
Yeah. Yeah.
situation. But it
yeah,
And
helps
the
the
my doctor
pain.
tells me
But
it really
Yeah.
it
does.
definitely helps the pain.
Yeah.
And yeah, and my doctor tells me not to rely on it so heavily. But like you said, sometimes it's
yeah.
just gotta have it.
Mhm.
Yeah.
Yeah.
Well, ladies, the clock on the wall says we have to get on out of here. So, but I have one more question to ask you guys, and I see Jennifer is asking the same question that I wanted to ask you. And what advice would you give others battling lupus, especially at the beginning of it, when first diagnosed with it?
Mhm.
What
I,
advice would you give them?
I mean, I would say, I mean, first thing is for me, I would say try to figure out, what your triggers are, so you can minimize, the effects. Like I said, diet is very important and what you're doing. So I think that can save, a lot of people with the lupus getting worse and feeling bad all the time. So just kind of being more like proactive when you first start out. And finding, I think it's good, like you were saying, with the support groups. I think when you first are diagnosed with something, it's helpful to talk to people who actually know. Like, I
Mm-hmm.
don't have to sit there and explain to you what I'm going through because you already understand. So, like you said, maybe in the long term, it might not be, as great for your mental health because it's a lot of, people constantly talking about how sick they are. But for when you're first diagnosed, they have a lot of different Facebook groups online for lupus. So, joining that and also just educating yourself on, your disease and being like your, biggest advocate, especially when you're going to the doctor and you're going to the hospital, like, so, they'll take what you're going through seriously.
Yeah,
Right. And
and
I agree with that. I
yeah,
agree that education was very important. It,
yeah,
it was very important for me. But like I said, everybody is different, and you gotta, you know yourself, and you know what you can take, and you know what you know when you need to back off. But I just think that knowledge is always the key in anything that we go through. So the education is definitely something,
yeah,
and just try to learn more, learn your body. It's you'll be on support groups, and you're talking, and learning things, just like we've all learned some things
yeah,
tonight. But you have to learn your body, and what
that's
pay
important.
attention to what you're going through, because your route and your journey may be a little different than somebody else with lupus. So you
Yeah,
gotta pay attention to it.
yeah, yeah. That's
I would say educate your family as well and your friends because sometimes it's people don't understand because people are visual. Like if you're not, missing a limb or bleeding and everything, they not, sometimes they don't take it seriously. So I would say like
that's true.
explaining to your
Exactly.
family and friends, and if you're
Yeah,
at your job, your coworkers, like what you're going through and what your body is going through, and it'll definitely be easier for you because sometimes people look at you like, well, why can't you just do this?
yeah,
Like why don't you just walk down the steps? Stop being, lazy. I'm like, I can't breathe. That's why.
yeah. That definitely helps to lessen the stress when you're around people that understand and that
What
are
you're
willing to
going
support
through.
you. Yeah,
Yeah.
yeah, yeah.
Right.
Mhm.
Right.
Dr. Reed, you have anything you want to say? You ended up with?
No, I just agree with everything they say, and get enough rest. Be sure you get enough rest.
Right.
That's very important,
Yeah,
And
Yes,
anything, really. And anything.
yeah, and be a partner with your healthcare provider.
yeah,
Speak up.
Right.
Be an advocate for yourself. I'm a firm believer in being an advocate for yourself.
yes,
This is your
Right.
body.
yeah.
This is your illness, and don't be afraid to speak up for yourself.
Right.
Is it
Right.
vitamin D really important too?
I think vitamin D is very
Yes,
important. Very important. Very important. And
that
for some
baby.
reason, in this day and time, there are a lot of people that are vitamin D deficient. I know we're not talking about that, but check your vitamin D. All right.
Kim, is there a support group in Beaumont?
Not that I know of.
Okay. Okay. Would,
I'm not aware of any either.
yeah.
Yeah.
So, I mean, maybe you could start one, you know?
Hmm.
There's a lot on Facebook though.
Huh?
I said there are several on Facebook. Like if you just Google like lupus support groups, there are a lot of
Mhm.
them on Facebook, and that's kind of a good way to start.
Right.
Yeah.
Guys, I really, really, really appreciate you tonight because you have really given a lot of us a lot of information about lupus that we didn't know. I mean, like I said, Andrea's my first cousin. I didn't know all that what she's going through. Now that we know what's going on, we could be there to support her in whatever situation, you know. But I appreciate it, and I know the viewers appreciate you guys, and just we might have a part two one day. Who knows? So because it's a lot of illness we don't talk about. We just don't talk
Yeah,
about it,
yeah,
and lupus is one of them.
yeah,
And there's a lot of people that have it, and we just don't mention. All we mention a lot is high blood pressure and diabetes
yeah,
Yeah.
yeah.
and cancer.
That's it.
That,
Yeah.
that's
Mhm.
that's mainly it. But
Mhm.
people go through more than that,
Yeah.
That's
And
true.
so, like I said, I appreciate you guys. And y'all hold on a minute while I talk to my audience and get them off. But I appreciate you guys for coming on tonight and supporting us with your questions. If there's anything that you would like for me to have as a podcast, inbox me and ask me to get someone to speak on that subject. And trust me, I will. I will try my best to find someone on that, and we'll go from there. God bless you. God keep this my prayer. Don't forget, June the 7th, we go out to vote. We vote in our mayor positions with Robert Donato Mouton and Ron West. So read upon them, talk about them to somebody, and go out and vote June the 7th. June the 19th is the actual election day. We need you out there to vote. We need a mayor in Beaumont. We need a good mayor. We need someone who's going to run the city and hold them responsible for running this city. Beaumont is lost. So let's come on, y'all. Get out there and vote. God bless you. God keep this my prayer. Smooches, guys. Bye. If I can have somebody that pass along this way, then I know that my name is not in vain. Almost forgot. Oh, y'all.